Alcohol is a drug that is frequently enjoyed by millions of people on a daily basis, including singers. Social drinking is customary and usually expected in the entertainment world. While alcohol may allay anxiety for performers, it is extremely detrimental to the vocal folds and the physical and emotional body in general. Alcohol, along with the environment that alcohol is usually consumed in, can cause many health problems for singers and may eventually lead to an unusable singing voice. Drinking, in combination with the environment of most bars, is a situation that should be approached carefully by singers. What is alcohol? Alcohol is a drug classified as a depressant, meaning that it slows down vital functions of the body. Ethyl alcohol, the alcohol used in libations, is produced by the fermentation of yeast, sugar, and starches. While beer and wine have a low percentage of alcohol, liquors usually contain at least 40% alcohol. Alcohol is rapidly absorbed from the stomach and small intestine into the bloodstream, where it begins to be metabolized in the liver by enzymes. However, the liver can only metabolize a small amount of alcohol at a time, which leaves the excess alcohol free to circulate throughout the body. The amount of alcohol a person consumes in a period of time affects their symptoms, and the more alcohol a person consumes, the more likely they are to become intoxicated. Most drinkers achieve the stimulant effects of drinking, which include disturbed perceptions, unsteady movement, and slurred speech. When a person consumes more alcohol than their body can handle, the depressant effects show themselves in the form of a loss of coordination and control of the body. The most severe depressant effects are vomiting, inability to feel pain, unconsciousness, coma, and even death. This occurs because when the amount of alcohol in the blood exceeds a certain level, the respiratory system slows down and oxygen can no longer reach the brain. So how does alcohol affect the voice? Dehydration. The body recognizes alcohol as a poison and works very hard to remove it from the system. After consumption, the body begins to release fluids to flush the alcohol out, resulting in dehydration. This is because alcohol is a diuretic, increasing the body's production of urine. This is an acute situation and can affect the drinker extremely quickly after consumption. When the body begins to dehydrate, water is pulled from the systemic hydration systems in the vocal folds. This disrupts the fluidity of the connective tissue membranes in the vocal folds, meaning that the flexibility of the vocal fold ligaments will decrease. Hydration is essential for the muscles and mucous membrane of the vocal folds to maintain their flexibility and agility because the folds rely on moisture to vibrate and create sound. Voice scientist Ingo Tietze proposes that the energy required to drive small amplitude oscillation of the vocal folds depends on tissue biomechanical properties. This driving energy, referred to as phonation threshold pressure, or PTP, is a measure of the ease of phonation and indicates vocal fold health. A low PTP is a good PTP. A study conducted by Dr. Catherine Verdellini, professor of communication sciences and disorders at the University of Delaware, sought to compare the effects of hydration treatment and dehydration challenges on PTP in healthy adults. Dehydration increased PTP, while the placebo and hydration conditions did not, demonstrating that drying challenges have detrimental effects on vocal function. This study primarily used systemic means to induce dehydration. However, reducing surface fluid alone may also have adverse effects on vocal function. Inhaling poorly humidified air for 15 minutes through the mouth increased PTP in healthy subjects, and individuals reported symptoms of vocal fatigue and throat dryness. Dehydration induced by rapid, deep breathing also demonstrated a tendency to increase PTP, suggesting that the laryngeal mechanism may be sensitive to both the rate and extent of surface dehydration. Singers sometimes push harder to compensate for a dehydrated voice not being as strong as it usually is, which could result in hemorrhages or polyps. The larynx will overwork while dehydrated to make up for the lost moisture to reach pitches that cannot be obtained. Cognitive function. An apparent problem with the consumption of alcohol right before a performance is the effect it has almost immediately on coordination, concentration, and judgment. Alcohol alters the levels of neurotransmitters in the brain, increasing the inhibitory neurotransmitter GABA, which reduces energy. For singers, this is detrimental because speech and movements are slowed, which could result in a colossal error on stage. Alcohol also increases the levels of dopamine in the brain, which can result in unwarranted bravado, as well as the feelings of a fantastic performance when it might not have been very good at all. A performer influenced by alcohol or drugs may perceive his voice to be outstanding at the very moment that the sound heard by the audience may be lacking in quality and fine control. Many performers in the West End of London habitually gargle and swallow port before going on stage. Alcohol acts as a muscle relaxant and depressant, much like a tranquilizer, and control of the vocal folds and sensitivity of the throat are likely to be impaired. The alcohol is only giving this performer a false sense of security. When performers continuously rely on alcohol to settle their nerves, they may form an alcohol dependence or become an alcoholic. Alcoholics usually obtain about 50% of their calories in the form of alcohol, which leads to major nutritional deficiencies and endless health problems. Habitual drinkers also often suffer from excessive vascularization, a drop in fundamental frequency, and hoarseness. Laryngeal disorders. Laryngeal disorders are very prevalent among drinkers, and while some are easy to treat, some can be deadly. Within 1 hour of alcohol intake, subglottal and false folds, along with the arytenoid regions, are affected with tissue changes and engorgement. Any tissue change in the larynx will alter the production of sound from the vocal folds. Singers are usually very attuned to their own voice and should notice a change almost immediately. Alcohol is a general irritant to the larynx and can be the cause of or supplement laryngeal disorders. One of the first symptoms of a laryngeal disorder is dysphonia, or any alteration in normal phonation, often characterized by hoarseness. Alcohol irritates the mucous membrane of the larynx, causing the folds and pharyngeal lining discomfort and leading to throat clearing. Excessive throat clearing abuses the larynx. Drinking also increases a person's chance of getting acute laryngitis, which can lead to chronic laryngitis. Cancer. The largest effect of alcohol studied and observed by doctors around the world is cancer. Alcohol consumption increases the likelihood of cancers of the pharynx and larynx, and a study published by Hashibe in 2009 found that tobacco and alcohol use increased the risk of cancer in the head and neck. These cancers can be located on the vocal folds or brain sections involved in motor skills, which affect the vibratory subsystem of the vocal folds. This shows how one's vocal performance could be easily affected by prolonged alcohol use. A study by Bonn was conducted that focused on the effects of alcohol on the pharynx, oral cavity, larynx, and esophagus. The study stated that drinking 50 grams of alcohol a day increases the likelihood of gaining these forms of cancers by 2 to 3 times compared to non-drinkers. These studies support the notion that alcohol increases the chance of cancer, which decreases the effectiveness of the vocal muscles. Drinking environment. Another idea to consider is the effect that the drinking environment has on the voice. Bars are notoriously smoky, and some constantly have loud music blaring over their sound system. Simply being in a bar while sober can cause many problems with the voice. While enjoying drinks for 4 or 5 hours, a person could also be inhaling the toxins in tobacco for the same amount of time without really thinking about the consequences because they are not the one actually smoking the cigarette. One does not have to smoke a cigarette to be ailed with the health problems they cause. Living in a home with a smoker or being in smoky environments for extended periods of time is extremely harmful to the voice. Long-term exposure to tobacco in the air can cause the toxic chemicals to build up in the body, damage the lining of the vocal tract, as well as the lungs, heart, and circulatory system. Dr. Robert Satelloff, professor and academic chair of the Department of Otolaryngology at Drexel University College of Medicine, explains why the lungs are so vital to singers. The lungs are critical components of the power source of the vocal tract. They help generate an airstream that is directed through the trachea toward the undersurface of the vocal folds. The vocal folds respond to the increase in subglottic pressure by producing sounds of variable intensities and frequencies. The number of times per second the vocal folds vibrate influences the pitch, and the amplitude of the mucosal wave influences the loudness of the sound. The sound produced by the vibration or oscillation of the vocal folds passes upward through the oral cavity and nasopharynx where it resonates, giving the voice its richness and timbre, and eventually it is articulated by the mouth, teeth, lips, and tongue into speech or song. Any condition that adversely affects lung function, such as chronic exposure to smoke or uncontrolled asthma, can contribute to dysphonia by impairing the strength, endurance, and consistency of the airstream responsible for establishing vocal fold oscillation. Vocal abuse in the form of speaking very loudly for extended periods of time frequently manifests itself in bars. A high ambient noise level makes it difficult for a person to monitor how loudly they are speaking. To be heard above the noise, one must generate a greater airflow, to which the vocal folds respond with greater resistance that is equal to laryngeal tension. Even in bars where there is no music playing, the general volume of conversation is very loud simply because of the crowd. Speaking loudly for the sake of being heard, and yelling like many intoxicated people do when they are excited, as well as singing along loudly to music, can result in prolonged laryngeal tension. Prolonged laryngeal tension can result in dysphonia and even vocal nodules. Singers are especially vulnerable to nodules if they talk or sing excessively while suffering from laryngitis. Vocal nodules can be removed surgically or may go away with extreme vocal rest. Singers that form vocal nodules are unable to perform for long periods of time and may never regain their voice to the level it was functioning at before the formation of the nodules. Another less common lesion is a contact ulcer, which may also arise from prolonged vocal abuse. So, is that drink worth it? Some singers choose to avoid alcohol completely, but many do not choose this. If consuming alcohol cannot be avoided, there are a few tactics a person can use to reduce their symptoms and keep the voice in a healthier state. Every drink should be followed by a glass of water. This helps the body maintain a higher level of hydration. Only one drink should be consumed per hour, and it is unwise to mix many types of alcohol in one night. If smoking is allowed inside the bar, try to stay outside if there is a patio, or find a bar that does not allow smoking inside. Move away from speakers or find bars that do not have loud music. If possible, sleep for 8 hours a night after a night out. The next morning, drink water and fruit juice, no sugar added, to rehydrate. Take B vitamins along with a multivitamin and rest the voice completely if at all possible. Take a long hot shower or use a steamer to hydrate and clear out any mucus buildup in the larynx. Drinking should be avoided the day of and even the day before a performance. I personally think that if a singer is looking to become the best singer in the world, they should probably avoid alcohol and bars completely. While it is impossible to avoid getting sick or to breathe toxins, avoiding bars is at least a sensible precaution. If that is not someone's goal, I see no reason why they could not enjoy alcohol in reasonable amounts. Cheers!